Okay, so we're going to go ahead and continue our conversation about the axial skeleton, chapter 7, part 2. Yay! Okay, so this week, please make sure that you've answered the study guide for chapter 7, that you have completed the study guide, or sorry, the quiz by Friday at midnight, and then also make sure you're keeping your eyes to next week, and that homework 7, the adaptive practice on chapter 8, is due next Monday. The other thing I would kind of note here is the prose section that is due on Friday as well at midnight. It is worth 25 points, so please make sure that you do not forget to do this. Midnight, what to say, 12 a.m. Wow. So yeah, pro section as well. I would hope that by the end of the semester, my handwriting gets far better, but has not seemed to be the case quite yet. Okay, so again, please make sure that you're staying on top of all of your assignments. They add up quickly. Just think, 10 points for one of these assignments is basically 5 questions on an exam, correct or incorrect. So do with that information what you will. Okay, so the study guide this week, just make sure that you're staying on top of this. You're filling out all of these questions prior to coming to class on Thursday. Identifying normal curves of the vertebral column, structurals of the vertebra. So we're going to be talking about the vertebra as well as the sternum and ribs and other features of the axial skeleton, including diseases of the axial skeleton. Okay, so the vertebral column, you can see here, it's also known as the spinal column, the backbone or spine. It's composed of 26 vertebra, divided into 5 regions, and it protects the spinal cord. So if we look at the superior region of this, here you have your 7 cervical vertebra, your 7 cervical cervical vertebra. So when we say superior, we mean that this is your head right here. It's sitting on top of your spinal column. And we'll just give this guy some hair. You can tell I'm in a weird mood today. Next, you have your thoracic vertebra. So here you see number 1, that's where the numbering starts, all the way down here to number 12. So those 12, you have thoracic vertebra. Again, these are based off of the locations and they correlate to those locations, and we'll talk about areas that are commonly undergo stress or fractures a little later on. Next, you have the lumbar vertebra. There are 5 there. Here you can see some intervertebral discs. That's those white areas between each one of those vertebra, and we'll talk about what those discs do. Hopefully you can kind of surmise that due to their location, they're probably going to be important in cushioning between those vertebra, so you're not compacting bone on bone. You'll also see here down at the very bottom, you've got your sacrum and your coccyx. Coccyx more commonly known as your tailbone. So you have those kind of 5 different regions of the vertebral column. And you can see here the number of vertebrae that are located within each, as well as what their names are. Okay, so curves of the vertebral column. So you can see here normal curves, you have primary and secondary. If you are going to look at the spinal column in a fetus, you can see there's just one single curvature on that fetus. Now, as we grow and develop, and again, the force of gravity is impacting this column, you can see how the shape essentially changes. And so instead of the single curve, you have 4 different curves within the column. First, starting up here, you can see kind of within the thoracic region, not thoracic, in your cervical region. Cervical region, here you have your first curve. In your thoracic curve, you have second, again, those thoracic vertebra. Your third coincides with that lumbar curve, and your fourth, again, is your sacral curve. So here you can see your sacral curve at the bottom. It's composed of your sacrum and your coccyx, and then you have your lumbar curve, which is formed by 5 of the lumbar vertebra. So those 5 lumbar vertebra that you see here. Your thoracic curve that's formed by the 12 thoracic vertebra, and then your cervical curve, which is formed by your 7 cervical vertebra. So what makes this nice is that the regions correlate very closely to the curves in terms of nomenclature, so their names are very similar. So hopefully that should aid in the memorization of this. if you're going to ask me right now, what do I need to know on this slide? Basically everything that I had just had circled. So you'll need to know what the sacrum is, the coccyx, the sacral curve, the lumbar curve, the thoracic curve, and the cervical curve. So make sure if I showed you those on a exam, you were able to annotate what they were. Okay, so these intervertebral discs I've mentioned in the few slides ago. So they're located between the vertebra from the second cervical to the sacrum. So if we go back the one slide. So second cervical to the sacrum. So that's quite a long distance there. It's a majority of the spinal cord. So you can see they're composed of fibrocartilage on the outer ring, and then the inner ring is composed of hyaline cartilage on top and bottom of each disc. So again, the cartilage is going to play an important role in cushioning between those discs. You don't want them compacting, you don't want bone on bone, you want this nice kind of cushion. So as you're, say, jumping or doing other things of high impact, that you are not crushing the bones that make up your spinal column. So they absorb shock and separate the vertebra from one another, so they play an important role again in that. So remember when we talked about the different types of tissues, we talked about cartilage. We specifically mentioned things like hyaline cartilage and fibrocartilage. So these are going to play an important role and compose those discs. And actually here at the end of this lecture, we'll actually talk about what happens when these discs get damaged and you no longer have them functioning in their cushioning role. Okay, so the intervertebral discs. So here we can see a normal intervertebral disc here. If we're going to look at the different regions of this, you can see that a vertebral body, intervertebral foramen, and then here you have the annulus fibrosus of the intervertebral disc. A compressed intervertebral disc is in a weight-bearing situation. You can see how much that cartilage has compressed here. Kind of the whole size of that is just kind of smooshed down. You can think of it for all intents and purposes, think of like an Oreo, right? An Oreo has that, you know, squishy white stuff in the middle. Nobody knows exactly what it's made of. Think of if you compressed and you put a bunch of pressure on that, how that would kind of flatten and cause it to kind of squish out. So the same thing happens with your intervertebral discs is when you have that squish, that force that puts pressure down on them, kind of squish. And then, like I said, there are instances where that disc can become damaged and that disc can come misplaced, and it can ultimately affect the way in which force is impacting those columns. So the vertebrae from each region, in addition to containing common structures, have unique structures to help identify which they are. So each one of these different kind of regions that we're talking about look different structurally. And so when I ask you, when people ask me, what do I need to know? You'll need to know the different regions, what's in the different regions and what their names are, and then you'll have to be able to identify those regions based off of this cross-section we're going to look at here. So here you can see a superior view of anterior. You can see that there is a facet for the head of a rib. You have your vertebral foramen, and then you have a facet of superior articular processes, and then you have your spinous processes, your transverse processes, and then your lamina of your vertebral arch and your pedicle. These again are going to be just regions located within each one of these vertebra. And then you have your vertebral column. Now, this is basically a cross section. Here you can see if you flipped it on its side, this is your transverse process. So the right posterior view of the articulated vertebra. You can see here the lamina. Here is your pedicle. So again, switching from your superior view to the right postlateral view of the articular vertebra, you can see how the structures sit together. What's also interesting to notice here, you have your intervertebral disc, your vertebral body, and then your inferior articular process. So this kind of gives you the different vantage points of each one of these on the column. It's important to recognize one of the main functions of this is to protect the spinal cord. So the spinal cord protection, again, this is all of your nervous system interacting with the rest of your body, is going to be protected right here with your spinal column. So spend some time maybe just looking at these different structures on each section. Okay, so again, if you're a very visual learner, click on this, show a nice video via Wiley Plus. Okay, so your cervical vertebra. So let's look at those first. So your first one up here, your C1, is actually called the atlas. Your second, your C2, is called the axis. And then you've got a typical cervical vertebra. So you can see kind of how they sit upon one another here. Again, the first one is your atlas, the second C2 is your axis. So you have C1 through C7. So if you remember the cervical vertebra, there are 7 of there. C7 is also called the vertebra formans. So this is going to be this part of your spinal column that's kind of within your neck. And here you can see the dens of axis, and that's going to be kind of a resting place, an interaction point of or articulation with the skull. So again, in terms of memorization, it probably would be worth knowing the atlas and the axis, and that there are 7 cervical vertebrae. Okay, so what does the cervical vertebra look like from the superior and anterior view? So if we look at that here, you can see the posterior arch. You'll notice that there's a huge region here, right? This huge foramen here that allows for the passage of the spinal cord, and it's going to get smaller as it goes down the spine. So the groove for the artery and first cervical spine is going to be located here. Here you have a transverse foramen as well. So there's foramen, and that's large hole again for the passage of the spinal cord. Here you can see the articular surface of the dens axis as well as the anterior arch. Now in terms of labeling a cervical vertebra, you're not going to be asked to do that. You are, however, going to be asked to identify, if I show you a cervical vertebra versus a thoracic, you should be able to determine what section of the spinal column it came from based on just the structure. So here you can see the spinous process. Again, the vertebral foramen, and then here you can see the articular surface of the anterior arch of the atlas as well. So again, each time you rotate this, basically a lot of the same structures are labeled. So just make sure that you feel comfortable recognizing, again, some of the larger structural components. Here you see the dens as well. The dens is going to be an important articulation of the anterior arch of the atlas. Okay, so that's the cervical vertebra. Next, you have the thoracic vertebra. Here you can see the thoracic vertebra region. T1, T2 through 8, and then T9, 10, 11, and 12. Here you've got your 12 thoracic vertebra. Here you can see the transverse process and the pedicle that have been labeled. And again, your spinous process is hanging out here as well. Once we see the anterior view, hopefully you can see some of the larger structural differences between the cervical and thoracic. So here you can see, again, the superior anterior view of the thoracic vertebra. So there's a large spinous process, as well as you can see a facet here for the articular part of the tubercle of the rib. The vertebral body is quite large in comparison. Here is that superior articular facet that you can see again. So in this particular region, you've got a lot of articulation points for the ribs. That's probably another good way to tell a thoracic spinal column component versus the cervical. So the lumbar vertebra, if we're gonna go ahead and compare those with the cervical and thoracic, it's the largest and strongest. This is kind of the base of your back. Here you can see the region that is considered lumbar. You have, large intervertebral discs located in that region. That's important, especially in your lower back, just because there's a point of weight. Your spinous process is going to be a different shape than what we saw in the thoracic and the cervical regions. And so let's go ahead and look at that anterior view to kind of really check that out. And it says no special structures are associated with this. What are there special structures? No, just the rib head and tubercle attachment. So here you can see a very large vertebral body as comparison to what we saw in the cervical and thoracic. Look how large that is. You have a pedicle. The vertebral foramen is very much smaller than what we saw specifically in the cervical large spinous process. Your lamina, pedicle, we've seen this all before. Here you have a transverse process. You'll notice that there are no articulation, no points of articulation with any ribs at this point in time in your lumbar region, only in the thoracic region. Okay, so this is probably the slide I would use to study, honestly, because it does a very good job of just showing you the structural differences between each one of these. So here you have your cervical, your thoracic, and your lumbar. What is the size of that lumbar area? Or sorry, what is the size of the vertebral body? That's one main difference, as well as your spinous process is going to change as well. So here you can see the vertebral body is much smaller here. Here you have it slightly larger, and then here you have your largest. There's your foramen. Here you have one vertebral, and here you have one vertebral and two transverse foramina. Again, these holes here that allow for large processes, structures to enter and exit through the spinal column. So this, again, like I said, would be a great compare and contrast slide that I would use while I was studying. Okay, so this another kind of description of all of the comparisons here. You can see that the spinous process is slender in your cervical, long and fairly thick, and short and blunt in your lumbar. Your transverse processes, as we compare and contrast those between each one, again, you have very small, large, and blunt. So hopefully you're kind of recognizing a common theme here. The facets for the ribs, again, in cervical and lumbar, they're going to be absent, which makes sense if you think about where your ribs are located on your body. Only in that thoracic region will you have that articular facets for your ribs. Direction of articular facets, posterior superior, posterior lateral, and medial. And for your inferior facets and interior, inferior, anterior, medial, and lateral, these are not necessarily things I'm going to ask you to memorize or know. And then the size of the intervertebral discs, thick and relative to the size of the vertebral bodies, which is pretty small, thin and relative to the size of the vertebral bodies, which is a little bit larger. And then here is where you're going to have your thickest and probably largest, because the body of your vertebral disc is going to be much larger. So again, this is nice kind of compare and contrast of each of these different regions. So probably a good thing to study. Hopefully you got a sense of what you can ignore, aka the directions of the articular facets. Okay, the sacrum and the coccyx. So we're working our way down the spine. So the sacrum is this triangular shaped. It's an irregular shaped bone. If you remember, we talked about different shapes of bone. It's part of the pelvic girdle, which is something that we'll talk about next week when we're talking about the appendicular skeleton. And it's composed of 5 vertebrae that fuse. This occurs, I don't want to say later in development, but kind of later in fetal development, I guess. And the coccyx is much smaller than the sacrum, but it's also triangular in shape. It's composed of 4 vertebrae that have fused. So here you see kind of a common theme that you're seeing fusion of vertebra, and they're leading to these irregular bone shapes. So here we can see kind of that shape here, S1 through S5, all of these fused vertebrae here, and then CO1 through CO4 down here, which makes up the coccyx. The base of the sacrum you can see located here. Again, this is more commonly probably known as the tailbone. Here's the sacral canal, kind of the spinal parts of the spinal cord are going to pass through. And again, in terms of all of these different surfaces, crests, foramens, I'm not going to be asking you about those. Again, I just want you to kind of focus on memorizing these main bones, some of the main structures of the bones. These are probably main structures of both the coccyx and the sacrum, but I do not think that is something that you would see on an exam from me. So hopefully that alleviates some anxiety. Okay, so we're continuing to talk about the axial skeleton. Next we have the thorax. Thorax is the entire chest region, as you can see here. So we've just finished talking about the thoracic vertebra. Here you can see T12 through T1. We have the things like the clavicle, the ribs, there's the scapula, as well as the sternum, and the xiphoid process. Those are some of the main components of the thorax. The rest of what you see here are most likely just bone descriptors, things like the suprasternal notch and the sternal angle and the costal cartilage. Again, not necessarily bones. There's a clavicular notch. And again, that's just giving you kind of orientations on how the bones are connected to one another in different notches and regions of the bone. Okay, so here's a video going over the different parts of the thorax. Okay, so the sternum, if we focus kind of at the center part of the chest, you have the sternum here. It's composed of 3 different regions. You've got the main upper mandible. You can see that located here. And then the middle body, you can see that here. And then the lower, xiphoid process that you can see here. You'll notice here's the clavicle notch. Again, that's where you see articulation with the clavicle and the suprasternal notch. So the mandible, again, is this main body here, your middle body, and the lower xiphoid process. The sternum articulates with the clavicles and with the costal cartilages that are extending from the ribs. One interesting note is that when people are given CPR, especially in older individuals, often if their CPR is administered correctly, there will be broken ribs, and sometimes the xiphoid process will also get broken off in that process. It's kind of, you go and find the xiphoid process. If you have, while you're administering it, you kind of feel that notch right there. Usually you try to steer clear of it. Okay, so the ribs. So if we move forward from the sternum to the ribs, there are 12 pairs of ribs. Again, this kind of alleviates any type of harsh memorization. You just have 12 pairs. You have true ribs that are vertebrosternal ribs. So those first 7 pairs, their cartilage is directly connected to the sternum. So you have the sternum as your center part, and you've got connection to that. Then you have your false vertebrobronchial ribs. Those next 5 pairs, the cartilage is indirectly connected to the sternum, which we're going to see on the next figure. And then lastly, you've got your floating or vertebral ribs, and those are the last 2 pairs that aren't connected to the sternum, aren't also interacting with that cartilage. They're just kind of hanging out way down there at the bottom on their own. Again, one of the main functions of the rib is to protect those very important organs in your thoracic cavity, your heart, your lungs, things like that. So the ribs are going to provide a nice structure for that. If we look at an individual rib, we can see here that and this is an example of terminology that we saw in the previous lecture. You've got the head of the rib, the neck that connects to the head. Here's your tubercle, here's your articular facet, your costal edge, and your costal groove, as well as your body and the facet for your costal cartilage. Again, this is what's going to connect out to the sternum. So if we look at kind of the connection process here, you can see the head of the rib, the facet for the tubercle cartilage of the rib. The space between the ribs is called the intercostal space, that space between ribs. So that's kind of, I guess, an important nomenclature to note, is that intercostal space is that space between ribs. Ooh, a highlighter, that's fun. And then you can see down here, maybe I should just use that. Oh, sorry, getting distracted here with the okay, so here you can see the spinous process of the thoracic vertebra, and then the tubercle of the rib is going to come down, and you have this interaction here, point here, the facet of the transverse process, and then you also have the superior demifacet and the head of the rib are going to be interacting right at this point, kind of an extension of the vertebral body. Again, this is part of this is the thoracic vertebra, and this is where you're going to have articulation of the ribs with that particular region. What's also nice, coming back up to this figure here, you can see that as the ribs extend around, that there's this costal cartilage that's connecting the rib to the sternum. So this is kind of an interesting kind of tilted down vantage point of the thoracic cavity. Okay, so in terms of disorders of this particular region, many disorders that may affect the skeleton in one form or another. So this is, in some cases, there are disorders that will affect the skeleton, but they might affect the entire skeleton. We talked about osteoporosis and how that affects bone health. And so that's definitely something that if it's affecting bones, it could affect this region as well. But in the vertebral column, a herniated disc, this again is kind of what the disease state that I was referring to earlier. It can result due to trauma, or it can simply be associated with aging as well. So here you have that spinous process. You've got the spinal cord that's passing through, spinal nerves that are extending on either side, and then here you have your anterior view and your herniated disc. Oops, kind of hard to see. Your herniated disc. So if you look at this particular view advantage, this nucleus pulpus is kind of extending out, and it's putting pressure on the spinal cord, and this results in excruciating back pain. Here, if you have a herniated disc, it's going to press upon those nerves. It's going to cause pain in that area. Again, this happens pretty frequently, or most often, in the lumbar area. Other disorders of the backbone or the cervical column, you can have exaggerated curvatures. So things like scoliosis is an extended or is an increased lateral curvature. So we'll look at that curvature here in a second. Kyphosis is an increased thoracic curve, or lordosis, which is an increased lumbar curve, bend backwards. And so you can think of those people who are super hunched over, the large part of their back here, not necessarily hunchback, but just very curved out. Those are the kyphosis. And then the lordosis is the individuals who have that increased lumbar curve that's going to cause their stomachs to stick out a lot. Think of like, I guess I'm in small child mode, but think of like as small children kind of have you ever seen a kid who just has that belly that sticks out and they're just unapologetic about it? That's kind of like a lordosis type of stance where your whole belly's just sticking out. And we're going to see an image of that here in a second. Oh my gosh. So scoliosis is a curvature of the spine. So here you can see an example of scoliosis that is affecting the thoracic region right here. Next in kyphosis is this again affecting the thoracic region, the extension or over curvature of that region. Again, this might happen in an older population, kind of you're seeing that hunched over curvature of the spine. And then here you see lordosis, which could be an extended inward curvature that's seated in the lumbar region. Again, these different types of curvatures can occur and can be very physically apparent. Spina bifida is another disorder that can occur in the spinal column where the lamellae do not develop normally. You don't have complete fusion of the spinal cord and spinal column, and so the degrees may vary from minor to severe. Often spina bifida is a result of not enough folic acid in the diet of the mother, and so when people become pregnant, often it's highly recommended that they eat leafy greens because that contains a high amount of folic acid. But if anyone's taking a prenatal multivitamin, that should provide the amount of folic acid that they need to prevent this type of congenital birth defect. Other things that might occur to the spinal column are things like fractures of the vertebral column, most often in the C1, C2 through T and T12 through T2. So you can think in the neck region, not surprisingly, is going to have a lot of possible fractures just because of the motion, that incapacity, which can the force in which it can take. The spinal or nerve damage may occur as a result of the fracture. So if those bones are broken, they're kind of limiting the amount of protection that they can apply to that spinal column. And so it can really affect nerve innervation of that region. Okay, so ultimately we have wrapped up chapter 7. Just a quick reminder. So for chapter 7, part 1, Please make sure that you're learning those 22 bones of the skull and face. For this particular lecture, make sure that you're focusing on knowing those different regions and curvatures as well for the spinal column, as well as some of the important bones of the thoracic region, of the thoracic cavity. Make sure you have answered your study guide questions before you come to class on Thursday. Please make sure that you complete your quiz by Friday at midnight, plus pro section 1. And then also make sure that by Monday at midnight that you have completed your adaptive practice for chapter 8. Okay, well this one was a pretty quick lecture. Just take into account that the first lecture, part 1, was pretty long. There was actually 50 slides. This one was only 30. So yeah, this one's a little bit quicker. Hopefully you learned a little bit something today. If you have any questions or concerns, please feel free to reach out. And yeah, just in a super weird mood today, so just chalk it up to that. Hopefully the whimsy was appreciated and it made the lecture a little less mundane. Okay, hope everybody has a great day.